Pancreatic cancer is one of the deadliest cancers in the world, and most people do not recognize the warning signs until it is too late. Every year, tens of thousands of lives are lost. Survival rates remain low, largely because this disease is usually discovered at an advanced stage. In many cases, the symptoms were present for months, but they were ignored, misunderstood, or attributed to something minor. The pancreas is a small organ, about the size of your hand. It sits deep inside your abdomen, hidden behind the stomach. It produces enzymes that digest your food and hormones that control blood sugar. You cannot feel it working, you cannot see it, and when something goes wrong, the signs are often subtle. Today, we will go through 8 warning symptoms that should never be ignored. Some of them may seem ordinary. That is exactly why they are dangerous. This video is for educational purposes only. If you notice any of these symptoms, speak to a qualified medical professional immediately. Let us begin. Number 1, dark yellow or brown urine. Your urine color can be an early warning sign of a deeper problem. If it suddenly turns dark yellow, brown, or tea-colored, and you are drinking enough water, this change should not be ignored. In pancreatic cancer, a growing tumor can press on or block the bile duct. This duct normally carries bile from the liver to the intestines to help digest fats. When it becomes blocked, bilirubin, a yellow pigment produced during the normal breakdown of red blood cells, cannot drain properly. Instead, it builds up in the bloodstream and is filtered into the urine. This excess bilirubin causes the urine to appear unusually dark. Many people assume they are simply dehydrated and try to correct it by drinking more fluids. However, dehydration-related urine typically lightens quickly. If the dark color persists for several days despite proper hydration, it may signal bile duct obstruction and requires prompt medical evaluation. Number 2, persistent upper abdominal or back pain. Pain related to pancreatic disease is often subtle at first, but it has distinct characteristics. Unlike common stomach aches caused by indigestion or gas, this pain is typically dull, deep, and persistent. It is not sharp or cramping. Instead, it feels like a steady pressure coming from deep within the upper abdomen. Many people notice that the discomfort spreads to the middle or lower back. Some describe it as a band-like ache wrapping around the torso. This pattern occurs because the pancreas sits behind the stomach, close to major nerves and the spine. When a tumor grows, it can press against these nerves and surrounding tissues, triggering ongoing pain. The discomfort often worsens after meals or when lying flat, and may slightly improve when leaning forward. If this pain persists, gradually becomes stronger, or continues for weeks without a clear cause, it requires medical evaluation. Persistent pain should never be dismissed as simple indigestion. Number 3, ongoing bloating or early fullness. Feeling full after eating only a small amount of food is not something you should ignore, especially if it happens repeatedly. This symptom, known as early satiety, can signal a deeper digestive problem. The pancreas plays a critical role in digestion. It releases enzymes that break down fats, proteins, and carbohydrates, so your body can absorb nutrients properly. When a tumor interferes with this process, digestion slows down or becomes inefficient. Food may remain in the stomach longer than normal, creating a sense of pressure, tightness, or swelling. You may notice that even a light meal leaves you feeling overly full and uncomfortable. Unlike occasional bloating caused by diet or stress, this discomfort tends to persist. It does not improve significantly with antacids, dietary changes, or simple home remedies. If bloating and early fullness continue for weeks without a clear explanation, medical evaluation is important. Ongoing digestive changes should never be dismissed as minor. Number 4, swelling of the gallbladder or liver. The pancreas, liver, and gallbladder work as a connected system. Bile is produced in the liver, stored in the gallbladder, and carried through the bile duct into the small intestine to help digest fats. When this pathway becomes blocked, serious problems can develop. In pancreatic cancer, a tumor can press against or obstruct the bile duct. When bile cannot drain properly, it begins to back up. This buildup increases pressure inside the system, causing the gallbladder to enlarge. The liver may also become swollen as bile accumulates within its ducts. In some cases, a doctor may detect this enlargement during a physical examination by gently pressing on the abdomen. More commonly, imaging tests such as ultrasound or CT scans reveal the obstruction and organ swelling. This type of blockage is not minor. It disrupts normal digestion and can lead to jaundice and infection. Swelling of the gallbladder or liver always requires prompt medical evaluation and further investigation. Number 5, unexpected blood clots. Blood clots are not always random events. In some cases, they are an early sign of an underlying cancer, especially pancreatic cancer. This disease can make the blood more prone to clotting. Tumor cells release inflammatory substances into the bloodstream that disrupt the body's normal balance between clot formation and clot prevention. As a result, clots can form without the usual triggers, such as surgery, injury, or long travel. One common presentation is deep vein thrombosis, or DVT. This typically occurs in the leg and causes swelling, warmth, redness, and pain in one limb. The leg may feel tight or tender to touch. A more dangerous complication occurs if part of the clot breaks loose and travels to the lungs. This is called a pulmonary embolism. It can cause sudden shortness of breath, sharp chest pain, dizziness, and a rapid heartbeat. This is a medical emergency. Any unexplained blood clot, especially without clear risk factors, requires immediate and thorough medical evaluation. Number 6, fever and recurrent chills. A mild fever that comes and goes is often dismissed as a minor infection or simple fatigue. However, when fever appears without a clear cause, it should not be ignored, especially if it occurs alongside symptoms such as jaundice, abdominal pain, or unexplained weakness. In pancreatic cancer, inflammation of the pancreas or blockage of the bile duct can trigger a systemic inflammatory response. When bile cannot flow properly, it may lead to irritation or infection within the biliary system. The body reacts by raising its temperature as part of its immune defense. You may notice episodes of chills, shaking, or night sweats followed by periods of fever. Unlike common viral infections, these fevers may not follow a predictable pattern and often return repeatedly. If fever and chills persist for more than a few days without a clear explanation, medical evaluation is essential. Recurrent, unexplained fever is a signal that the body may be fighting a deeper internal problem. Number 7, severe fatigue and physical weakness. This type of fatigue is very different from everyday tiredness. It is not caused by a busy schedule or a poor night's sleep. It feels deep, constant, and overwhelming. Cancer-related fatigue does not improve with rest. You may sleep for many hours and still wake up feeling drained. Your body feels heavy. Your muscles feel weak. Even simple activities, climbing stairs, carrying groceries, or walking short distances may suddenly require far more effort than before. This happens because cancer changes how the body uses energy. Tumor cells compete for nutrients and disrupt normal metabolism. At the same time, ongoing inflammation places additional stress on the body. The result is persistent physical and mental exhaustion. Many people blame stress, aging, or overwork. But when weakness appears without a clear reason and gradually worsens over weeks, it should not be ignored. Persistent, unexplained fatigue deserves careful medical evaluation. Number 8, significant digestive changes. The pancreas plays a central role in digestion. It releases enzymes that break down fats, proteins, and carbohydrates so your body can absorb nutrients effectively. When a tumor interferes with this process, digestion becomes inefficient. As enzyme production decreases, or the pancreatic duct becomes blocked, food is not properly broken down. You may begin to experience persistent nausea, occasional vomiting, or a noticeable loss of appetite. Over time, this can lead to unintended weight loss, even if you are not trying to diet. One of the most important warning signs is a change in stool. Stools may appear pale, greasy, bulky, and unusually foul-smelling. They may float in the toilet due to excess fat content. This condition, known as fat malabsorption, occurs because the body cannot digest fats properly without adequate pancreatic enzymes. Digestive changes that continue for weeks without a clear explanation should never be dismissed. Persistent disruption of normal digestion requires medical evaluation and further investigation. Pancreatic cancer is often described as a silent disease, but silence does not mean absence of warning. The body usually sends signals. The danger is that these signals are subtle, gradual, and easy to explain away. Symptoms often begin quietly: a change in urine color, a dull ache in the back, persistent bloating after small meals, fatigue that does not improve with rest. Each symptom alone may appear harmless. It is easy to blame dehydration, poor posture, stress, aging, or diet. The real risk lies in ignoring patterns. When these changes persist, worsen, or appear together, they may point to a deeper problem. Pancreatic cancer is frequently diagnosed late because early symptoms are mistaken for common conditions. Early detection significantly improves the chance of treatment and survival. Paying attention to your body matters. If you or someone close to you experiences ongoing, unexplained symptoms, do not delay seeking medical advice. Timely evaluation can make a critical difference. Awareness is not fear. Awareness is protection.